What's up? My name is Cameron. I am the creator of Thrivency, a brand new media platform focusing on the intersection of cultural identity and wellness. So, what can you find on Thrivency? Thrivency is a website where you can find different wellness news articles and insights from our team. You can also find some really fun and informative short form content across YouTube Shorts, TikTok, and Instagram. And now we're branching into some longer form video content like this, where I will give some deeper dives into different health and wellness events that I attend, as well as recaps of our insights or my perspective on different industry updates. So I attended the NAACP National Convention for the very first time this past weekend. It is still going on this entire week, but I specifically registered for the inaugural Health Equity Summit. It's happening in Charlotte, where I'm based, so I was like, this is an opportunity I can't pass up. And although the focus was much more on public health, resources for physicians and other medical professionals, I felt that there was going to be lots of really great discussions and data points that I could take away as someone that is establishing a wellness media platform. I took several pages of notes, but I'm just going to give you some high-level takeaways and kind of talk through some of the speakers that were there that really made an impact and stood out to me. Okay, so one of the first speakers was Dr. Roger A. Mitchell. He's currently the director of Howard Medical School, and he's the incoming president for the National Medical Association. So this is a Black man with two very public, visible leadership positions within the medical space. And, his speech was very passionate, it was very empowering, and it was very much a call to action. And he said, quote, "And our action is the only way we make progress," which is really in line with the tagline for the entire convention this year, which is the urgency of now. I think that the overall message of the convention this year, with using that tagline, the urgency of now, it talks about being organized as a Black community, coming together to take action in light of the political landscape that we find ourselves in light of legislation that is still being passed to actively sort of disenfranchise and take away the access that the Black community has to different necessary resources. This summit specifically focused on health and wellness resources, but that can apply across many different aspects of our experience. And so, yeah, this was pretty politically charged, but a necessary conversation in light of, recent legislative changes, which I will talk about the big, beautiful bill in a second. But in general, Dr. Mitchell really focused on our need to come together, especially the people in the room who are typically leaders in the medical space, leaders in the public health space, leaders in food access, mental health, all the different things, right? So to really frame this up, he shared this statistic. Social determinants make up more than 70% of our health outcomes. So aspects like where you are born, where you work, the community that you live in, those factors hugely determine whether long-term you will be healthy or sick and face worse health outcomes. Now, like I said, in light of the One Big Beautiful Bill that was just passed that has aspects of healthcare within the bill, in particular as it relates to who will access Medicaid once it goes into effect in 2026, he had these sort of calls to action or tips for the attendees to consider when it comes to how this bill is specifically going to impact the Black community, Black healthcare patients. One, we really as a community need to ensure people understand Medicaid. That's like baseline. I think the average American, myself included, I don't use Medicaid, but the average American, even if they do use Medicaid, that is their primary source of health insurance. It's such a complex system, and I don't think they really fully understand as an individual how to navigate it. Number two, how do we, those people that own organizations, that own businesses, how can they contribute to creating a nationwide network of volunteer opportunities for the people who need to qualify for the 80 hours a week. I'm sorry, not 80 hours a week. I believe it's 80 hours a month of either volunteer or work experience to continue qualifying for their Medicaid, right? So how can we provide opportunities for those people that may be facing certain health challenges that have prevented them from being able to meet a time requirement like that in the past? Also, how can we collectively leverage AI technology to help the community navigate the challenges and sort of the intricacies of how this is sort of muddying the Medicaid and health insurance waters? Another speaker also referenced the importance of leveraging AI in terms of like how can we help families bypass a lot of the paperwork that's now going to be required to continue your access to Medicaid. And I thought that was a really interesting perspective. Dr. Tony Price, who's a senior fellow for health equity at the NAACP, shared some of the preliminary results from the ACER Health Community Wellness Survey. And they actually gave us this handout, giving a little explanation of the ACER Health Community Survey. I will include an image of this so that you can actually scan the QR code on your screen, because again, these are preliminary results. They've collected almost 19,000 completed surveys, but this is still ongoing, and they need anyone and everyone who is able to complete this short survey, because it is incredibly important data that can be used to inform community health decisions. A lot of people, including myself, talk about how there's just simply not enough data. There's not enough studies that are really focusing on the needs of Black and Brown communities. So use this as an opportunity to provide input about your current health standing, your current wellness experiences, the lack of or availability of resources that are in your community, and what would you like to see? How can they help improve your well-being? Because the NAACP is listening, and it's in partnership with Sanofi. And I think it's just a really important opportunity to potentially make your voice heard. But so far, from the preliminary results, so these are the demographics they currently have, and this is why they're still encouraging people to participate, because they want to expand the demographics, right? So primarily Black African American respondents, which makes sense coming from the NAACP. 32% of respondents are between the ages of 25 and 40 years old. 71% have completed a bachelor's degree. 14% reported limited access to grocery stores, and 17% reported limited access to green space. 35% of respondents live with at least one chronic health condition. That really stood out to me. So that's over a third of these 18,000 respondents live with at least one chronic health condition. That's the current state of health and well-being in our country. Also, 1 in 5 respondents reported issues getting a healthcare appointment. There were also some other open-ended questions and answers, but those are just some of like the high-level statistics. But I am planning to take the survey. I encourage you to take the survey. It's incredibly important, again, that we are collecting data like this to better understand the current state of health and well-being in the Black community, as well as from an organization that is specifically working for the empowerment of the Black community, like the NAACP. And then a few of the panels, there's just so much. I can't get into all the panels.
Our mayor reallocated 5% of the police department's budget to create our Office of Violence Prevention. And in every city, the police department's budget is the biggest budget. And during that time, the budget was $235 million. So we got 5% to create an office for people who were victimized, people who needed help, people who needed healing, people who had addiction issues, people who had quality of life issues, had nowhere to go. And so we created that space for them to go. And we used and we transformed a police department precinct to do it. So they moved the police out and gave us the building. So now we're transforming how we do things. Now we're investing in what we really need. So we're not just talking about an investment in terms of funding, now we got a real estate investment. And so this is how we begin to transform, by using the social determinants of health, by using the health department as a partner, but using public safety dollars to fund it. And so we use social workers and outreach workers and victim advocates and those people for us to begin to say we need to look at the root causes of why this is happening. And the root causes said that we have a city that's full of trauma. We have a city that never healed. We had a city that was full of police brutality, drug addiction, violence, crime, all of those things. Now, how do we heal it? How do we go back and make sure we know that there was harm caused here? And now we got to go back and heal the harm that happened. And so that's how we begin to transform and look at social determinants of health.
Hookah has created a way, the industry has found a new way to destigmatize hookah and create an opportunity in our social settings. We all saw, maybe probably about 10 years ago, that it started being happy hours, right? And then we started seeing that it ended up being a part of everyday uses, and then you go to people's houses now, and they have hookah. And so we have to have an understanding, a conversation with people around what addiction looks like, and that there is nicotine in hookah products. And even if the label says that it doesn't have hookah, has nicotine in it, it more likely does. And so one of the things that this administration has done is already cut the ability for a regulation at the Center for Tobacco Products at the FDA to be able to even go in and be able to inspect these retailers and inspect people that you're actually buying the product from. So they have limited the capacity to do so.
And so a big part of what we believe is really imperative is that even as we talk about this federal approach, state-based approach to getting care, we also need to make sure we are also having an additional strategy of supporting our folks who are doing that underground wellness work, right? And the underground wellness work, let me give you some concrete examples that I see every day. When I see people who identify as big mamas or teachers who are actually recognizing that some of the kids who are given these medications are not being adequately monitored and the medication levels they are being given is not accurate, they're the advocates who are doing that when the psychiatrists and therapists are not. When I talk to pastors in our network who are actually trying to keep children and young people out of psychiatric holes, because they recognize that what happens for our folks, when you get into a psychiatric hold, it is the same thing as the prison system, right? And so our work is to support that network with more tools and resources, because it's that network, as the public health divestment continues, it's going to be the big mamas and the pastors and the barbers and the salons. It's going to be the babalawos and the imams and the folks who are going to be pulling up to make sure our folks are okay. So our part of our health strategy has to be, yes, continue to fight on that state and federal policy, but continue to invest in the community health workers who are holding it down. I say, every hood got a tarot lady, every hood got a big mama, every hood got a pastor or a deacon or church mothers who are holding it down. Are they equipped? And that is the focus of our work to really give us. So our training, they come to give trainings that are in our language, that give real evidence and education around what is mental health, how does medication work, all these pieces, so they can collaborate with health practitioners. This is the one thing I want to continue to drive home. A part of our strategy has to be to invest, not just in federal and state, but also in the community grassroots level.
Okay, and the final speaker I will share, Shakita Brooks LaShore. She's a former administrator for Centers for Medicare and Medicaid. So incredibly timely speaker to have in light of the One Big Beautiful Bill. But she was basically focusing on how there's really an economic imperative to advance the health of the nation, and how this bill is really doing the opposite, because it's not only going to affect the people that really qualify or may no longer qualify for Medicaid, but it's going to affect everybody in this country. She said, likely impacts if this continues. Hospitals will shut down. And currently, a third of bankruptcies are because of medical debt, and that number will only increase. She shared a really, really great quote: "When economics pervert the healthcare system, we all get sicker." That was very, very profound. She is also one of the speakers that talked about the strategy I mentioned earlier. How can AI help families bypass some of this cumbersome paperwork that's going to affect them? But in general, it's a call to action, especially for medical providers that were in the room too, is what are you willing to do if you have to help with starting to see patients that are uninsured? And how do you navigate the legal systems, the laws that are trying to be in place to prevent providers from doing that? But despite all of that, I'm still encouraged. After attending this Health Equity Summit, there are some really unique and revolutionary solutions, collaborations that a lot of these professionals are taking part in to preserve and advance the health of the Black community. I'm incredibly inspired because I'm more in the communications media space. I'm not a practitioner. I'm not the one helping people to heal necessarily, but I am the one that is trying to disseminate this important and helpful information to anyone that needs to hear it, if it is of help at all. So that was my experience at the Health Equity Summit. I really encourage anyone who has the opportunity to attend a national convention in future years to put this on your list to look out for. It's manageable price-wise, in my opinion, and not a huge time commitment to attend. In general, there was lots of other stuff going on in the national convention too. I did go down to the hub, which was on the lower level of the convention center, and it was kind of the big open space where there were local vendors, there were brand activations, and there was also a large stage where there were also different panels and speakers cycling throughout the day. And so I sat and kind of listened to some things about entrepreneurship in the Black community, preserving wealth in the Black community, home ownership, and there was a really cool panel from different authors that were there promoting new books and also doing book signings. So I got to meet one of my favorite authors, Kennedy Ryan, which was really cool because, to bring it all back to wellness, her most recent book in the Skyland series speaks a lot about wellness, actually, health and wellness, because the main character is assuming the position of becoming a caretaker for her aging mother who's dealing with Alzheimer's. And so they really talk about like caretaker well-being in that book. Another really cool opportunity to see Tamika Mallory speak. She is a well-known activist and social justice leader in this country. And she has released a new memoir, which she was there to promote. And she even spoke about, she dedicated her life, putting her life on the line for the advancement of other people. And in this memoir, she talks about how fighting for freedom of other people, she's entered a space in her life where that now includes her too, where she's still prioritizing her well-being. She's prioritizing how she cares for herself in addition to everything she does for other people in the community. So really, really overall cool experience. And that was just one day out of an entire week of programming. If any of this was interesting, or you have questions or thoughts about the Health Equity Summit, the current state of the health of the Black community, that's like a very large, lofty topic. Let me know your thoughts in the comments, and let me know if you like this event recap, and I will see you next time.